Adenoviruses causes, transmission, and prevention. Adenoviruses are a common group of viruses that cause a range of infections in humans, from the common cold to severe pneumonia. This article will provide a comprehensive overview of adenoviruses, including their origins, transmission, symptoms, and prevention. 1. Origins of adenoviruses. Adenoviruses were first discovered in 1953 in human tonsil tissues. Since then, numerous distinct types of adenoviruses have been identified, each capable of causing different disease manifestations. 2. Diseases caused by adenoviruses. Adenoviruses can cause a variety of illnesses, including the common cold. This is the most frequent respiratory infection caused by adenoviruses, characterized by symptoms such as runny nose, sneezing, sore throat, and mild fever. 2. Diseases caused by adenoviruses. Conjunctivitis. Adenoviruses can also cause conjunctivitis, an inflammation of the conjunctiva, the membrane that lines the inside of the eyelids, leading to symptoms like red, itchy, and watery eyes. 2. Diseases caused by adenoviruses. Pneumonia. In some cases, adenoviruses can cause pneumonia, an inflammation of the lungs, particularly in young children, elderly individuals, and those with weakened immune systems. 2. Diseases caused by adenoviruses. Gastroenteritis. Adenoviruses can also cause gastroenteritis, characterized by symptoms like diarrhea, vomiting, and abdominal pain. Cystitis. In rare instances, adenoviruses can cause cystitis, an inflammation of the bladder. 3. Transmission of adenoviruses. Adenoviruses are transmitted through various routes, including direct contact with an infected person, such as touching the sick individual or their personal belongings, can lead to adenovirus infection. 3. Transmission of adenoviruses. Respiratory droplets. The virus can be spread through small respiratory droplets expelled when an infected person coughs or sneezes. 3. Transmission of adenoviruses. Contaminated surfaces. Adenoviruses can survive on hard surfaces like tables, doorknobs, and toys for extended periods. Touching these surfaces and then touching the mouth, nose, or eyes can lead to infection. 3. Transmission of adenoviruses. Contaminated water. Some types of adenoviruses can be transmitted through contaminated water sources, such as swimming pools and lakes. 4. Symptoms of adenovirus infection. Symptoms of adenovirus infection can vary depending on the specific disease caused by the virus. However, some common symptoms include fever, cough, sneezing, sore throat, runny nose. 4. Symptoms of adenovirus infection. Fatigue, headache, muscle aches, vomiting, diarrhea, red, itchy, and watery eyes. 4. Symptoms of adenovirus infection. Pneumonia. 5. Diagnosis of adenovirus infection. To diagnose adenovirus infection, a doctor may perform several tests, including nasopharyngeal swab. This test helps identify the presence of the virus in the nasal and throat secretions. Blood tests. This test helps determine the presence of antibodies against adenoviruses in the blood. 6. Treatment of adenovirus infection. 6. Treatment of adenovirus infection. Currently, there is no specific antiviral medication for adenovirus infections. Treatment primarily focuses on managing symptoms. A doctor may prescribe pain relievers, fever reducers, and antihistamines to alleviate itching. Additionally, rest, adequate hydration, and proper nutrition are essential for a quick recovery. 7. Prevention of adenovirus infection. Several measures can help prevent adenovirus infection, including frequent hand washing. Washing hands frequently with soap and water, especially after contact with sick individuals or contaminated surfaces, helps remove the virus from hands. 7. Prevention of adenovirus infection. Covering coughs and sneezes. Covering coughs and sneezes with a tissue or the elbow helps prevent the spread of the virus through respiratory droplets. 7. Prevention of adenovirus infection. Avoiding close contact with sick individuals. Avoiding close contact with people infected with adenoviruses, particularly during their symptomatic period, is crucial. 7. Prevention of adenovirus infection. Maintaining good hygiene, keeping surroundings clean and regularly disinfecting hard surfaces with appropriate disinfectants can help prevent virus growth. 7. Prevention of adenovirus infection. Vaccination. Currently, vaccines are available to prevent certain types of adenoviruses, particularly in children. However, these vaccines do not protect against all adenovirus strains. Important notes: adenoviruses can cause severe illness in young children, elderly individuals, and people with weakened immune systems. If you suspect you or your child has an adenovirus infection, consult a doctor for timely diagnosis and treatment. Important notes: always follow your doctor's instructions and adhere to the prescribed treatment plan for optimal results. By understanding the origins, transmission, symptoms, and prevention of adenoviruses, individuals can take necessary steps to protect themselves and their loved ones from these common infections.